It's time for our nursing tip of the week, and in this week's tip, we are talking about bedside report. If you want to fire up some nurses, just ask them their opinion on bedside report because you're going to get such a range of opinions. But truly, when it comes down to it, bedside report is evidence-based and does show that it can help nurses have that continuity of care, consistency, early recognition, making sure everyone's on the same page. As you can probably gather if you've followed me for a while, I am a big pro bedside report person. I know that not every nurse enjoys it, but truly I think it's best for our patients, and ultimately that's kind of what we're there for. So bedside report consists of going into the room with the nurse that's coming on shift as well as the nurse that's going off shift and giving report just like you would outside of the room. The difference is while you're both doing report, you're both able to assess the patient together to make sure that the assessment is consistent. You're able to see what drips the patient's on, the rates that they're running at, check out the monitor, make sure there's no safety issues, do a quick skin check. And I really love bedside report because basically you're able to get your first assessment pretty much out of the way right at shift change. I also think it's great because it gets the patient and their family, if there's any family in the room, on board for hearing about their medical care so they feel involved. Now, I know that bedside report is not the greatest for every situation. Sometimes you may need to do a modified bedside report where you go in, check out all the basics, assess the patient, check the drips, the rates, do your quick assessment together, and talk about some of the other things outside of the room. However, the majority of the stuff can be talked about inside the room, and it's really good to make sure everybody is on the same page. So if your hospital's not doing bedside report, highly recommend you go talk to whoever would be in charge of implementing this new process, or maybe you can be in charge of implementing this new process because it's truly the best for our patients and helps you identify any quick needs right at shift change. And that's your nursing tip of the week.